Time now to ask the expert. Here to answer your questions live on air about osteoporosis is Dr. Sonal Haerter. Our first question says, when I think of osteoporosis, I think of older people falling and breaking bones. They can't be the only ones at risk here. So who is?
Okay, so basically aging causes bone loss. So everybody over the age of 50 has some degree of bone loss. But some other risk factors are menopause. So menopausal women should start to get bone density scans after the age of 50 and at least after the age of 65 for sure.
Okay.
But I tend to do it over 50 because some of them have accelerated bone loss.
Yeah.
People who are on chronic steroids, those people have higher risk, or seizure medications. People with inflammatory bowel disease affecting their bowels, so Crohn's disease or ulcerative colitis, celiac disease, people who have undergone bariatric surgery. These are some other risk factors for osteoporosis.
Wow. And of course, if they have any questions, definitely ask the doctor.
Absolutely.
Should I be getting this test?
Correct.
Okay. Debbie in Gilbert asks, I recently started taking Fosamax for osteopenia. Thank you.
Yes.
So glad I have you here. Could you briefly explain what that medication does, and is it a medication that one would need forever?
Okay, so Debbie, great question. So Fosamax is a medication that we actually use very commonly for osteopenia and osteoporosis. Just to tell our viewers, osteopenia is bone loss, but not as severe as osteoporosis.
Oh.
So this is actually preventing Debbie from getting to the osteoporosis stage. Okay. So Fosamax helps us by reducing bone breakdown or bone loss. So it kind of helps maintain the bone density.
Okay.
Now, to answer the question forever, it's not a medication we use forever. We use it typically for 5 years, and while the patient is on the medication, we tend to do bone scans to make sure that the medication is actually helping build the bone density.
Right.
So typically about 5 years. And then we do something called drug holiday, which is take a break and then reassess.
Oh, okay. Interesting. Josephine in Mesa asks, okay, I'm going to need help with this one too. Is true that
Alendronate.
Thank you. Tablets can only be taken for 5 years for osteoporosis? If so, what's a good replacement other than getting long-term shots?
Great question. Alendronate is Fosamax, and this is exactly what we just said.
Okay.
So up to 5 years, we know that it actually does help with bone building. After 5 years, there's a slight risk of more side effects versus benefits, and that's why that's a good time to assess. Is this helping, or do we need a different type of medication at this point to help with osteoporosis? Typically, if we don't see progression in the right direction, then we have to consider a different category of medication.
Yeah, something else.
Correct.
Okay, all right. Next viewer asks, what does the disease look and feel like?
Oh, what a great question. So this is where I want everybody to know it's a silent disease.
Yeah.
We really don't have symptoms of osteoporosis unless you get a fracture. Unfortunately, fracture can cause pain, and that can get your attention. But here are some things that to keep in mind. Loss of posture, stooping over, a loss of height can be some signs of bone loss. So that's one. And like I mentioned earlier, all biological females post-menopause should be getting scans on a regular basis.
Okay. This next viewer asks, for people who don't have it, how do you prevent it? Is it as simple as drinking milk or taking a calcium supplement? I didn't think about the milk.
Yeah, so milk has vitamin D and calcium. Those are good supplements for calcium and vitamin D. Here are some things. So having an active lifestyle. So for example, resistance training, any type of movement is going to help you build muscles and also help you with your bone health. Number 2, well-rounded nutrition. You want your vegetables, you want calcium and vitamin D food, resources in your food. So non-fat dairy or high-protein diet also helps with building your bone. Number 3 is actually checking your vitamin D levels to see if you have deficiency. If you do have low levels of vitamin D, you may need supplemental vitamin D. And lastly, we do have medications actually to prevent, but also to treat osteoporosis.
Excellent information.
I have 2 more things.
Oh,
actually,
yes.
Tobacco, so reduce or stop tobacco use. Smoking can affect your bone health, and excessive alcohol use can also cause osteopenia and osteoporosis.
Okay, great info. Sonal, thank you so much. We learned so much. I appreciate you.